Good evening, everyone, and thanks for
Good.
tuning in for this Ask Mary and Pat show, the monthly webinar series featuring Ms. Mary Fenner and Ms. Pat Boga. I am Thomas Robertson, better known as Duke, and I am the Technology and Metrics Director for Oak Hill Regional CDC. And just before we get started, we're going to do something different. I want to introduce you guys to a brand new initiative that Oak Hill Regional CDC is putting out, and I have just a brief presentation for that. And can everyone see that? Healthy Together Mississippi, empowering families, strengthening communities.
Yes.
All right,
Yes.
perfect. Okay, so in order to understand what Healthy Together Mississippi is, we have to go back to Oak Hill Regional CDC. And Oak Hill Regional CDC has been a leader in faith based health and wellness since 2002. And with that, we were able to establish Mid South Churches Cooperative Conference, and that was to unite pastors around health, education, and economic development. And in this presentation, you'll see some of those logos that we use. We have the Mid South Churches logo right there. And then the next thing that we did under the Oak Hill Regional CDC was secured federal funding in 2013 to create Get Covered Mississippi. And this was able to help thousands get enrolled in health insurance through the ACA Marketplace, or better known as what people call it, Obamacare. And so in 2019, we decided that we were doing well when it came to ACA, so we should go another step further, and we established Healthy Kids Mississippi, and that was to help Medicaid and CHIP enrollment. And so overall, to this day, and this probably isn't up to date. It says we've really nearly received 6 million in funding. I'm sure that's above now because I believe I got this stat from our website that I last updated that part maybe 2 years ago. So I'm sure we're over that now. And so after those initiatives, we came behind those with Pause, which was about mental health, and we did also Pause for opioid and other abuses. And so with that, we were able to come behind that with moms and dads. As you can see, we have a lot of initiatives. We have Get Cover Mississippi, Healthy Kids Mississippi, Pause, moms, dads. It's a lot of things that we're trying to help people across the entire state of Mississippi do. 2024 we released moms, and this year, matter of fact, spring 2024 moms was released, and spring of 2025 dads was released. And so that brings it all together. We wanted to just have everything under one thing instead of everything just being separate. So we did a state. It's Healthy Together Mississippi is a statewide initiative dedicated to helping families thrive physically, emotionally, and socially, rooted in a vision of unity and opportunity. The program connects communities to vital health resources. It fosters meaningful engagement and champions access through collaborative partnerships. So all those initiatives I listed out, whether it was Get Cover Mississippi, Healthy Kids Mississippi, Paul's, Moms and Dad, we just wanted to bring everything together, and today we have Healthy Together Mississippi. And that is on my next slide. So we have Healthy Together in the middle, along with our dads, moms, Get Cover Mississippi, Healthy Kids Mississippi, and Pause. And of course, Oak Hill Regional CDC is still the parent corporation of all these initiatives. So in case you are out and about and you see our dad signs or table throw or mom sign or Get Covered, either or those signs, you can see that we are all still Healthy Together Mississippi. And under the Healthy Together Mississippi, we've established a toolkit that's community driven resources to help faith based and neighborhoods groups promote healthier lifestyles. You can view this toolkit actually on our website, healthytogetherms.org, and click that tab that says Move Together. And you will have a list of different items and things that you can see, and you can even take part in and bring in your community together. And so now we have our newsletter that provides crucial updates to everyone across the entire state of Mississippi. And I'm sure we've had a few people from other states to sign up for this newsletter. So right now, take a minute to go to oklrcdc.org/, the Magnolia Post, or you can scan that QR code now and sign up for those newsletters. They come in bi-weekly as of right now. Um, Maybe soon we will move to a weekly schedule of the newsletters because they are becoming such a hit. I've received a lot of great feedback for those newsletters that comes bi-weekly. So I'm gonna leave that screen up for just a second and just take a minute to subscribe to our newsletter. And we will drop that link in the chat um, as the webinar continues on. For more information, you can call us. You'll hear this number over and over again tonight, 662-298-3584, or text us 662-689-9712. The website again is healthytogethermississippi.org. Email us at connect@healthytogetherms.org. And we just want to remind you that Healthy Together is a statewide initiative of Oak Hill Regional Community Development Corporations, and all donations and sponsorships are directed to that CDC, the sole legal entity supporting these programs. And if you have any questions about Healthy Together Mississippi, I'm more than welcome to um, elaborate more. I see we have a question. Uh, can you tell the what mom, dads, and Paul stand for? Moms stands for Maternal Outcomes Made Superb. Dad stands for, it's still new to me, so hold on, I know it as soon as it comes up on the website. Developing active, dedicated support. And the pause is the pay attention to body, thoughts, feelings, access what is activating me, understanding the roots of my feelings, S, set boundaries, ensure safety, E, empathize with those involved. And as we continue on these webinars, we will make sure we will have people on to talk about each of these initiatives more in detail. But if you'd like more information, again, please visit our website, healthytogetherms.org. And also download the app. I hadn't had a chance to tell you about the app yet. So go to your Google Play Store or Apple App Store and download the Oak Hill Regional CDC app. It is free of charge. And matter of fact, as soon as you open it, you will see the Healthy Together MS logo pop up. I'm trying to, let's see if I can blur my background and bring up the app. As you can see, something you can halfway see it, but that would be your best bet to find more information about all these different initiatives that we have. And I have went over well over my 2 minutes that I told the host that I was going to do. So without further ado, I'm going to turn it over to the host tonight, Miss Mary Fenner and Miss Pat Boca. Ladies, it's in your hands.
Okay, thank you, Duke, for that presentation. That was really great. Hello,
Yes.
everyone. My name is Mary Fenner, and I'm a Medicaid Application Administrator for Oak Hill Regional Community Development Corporation.
And I am Pat Boga. I am also Medicaid Applications Administrator and a Navigator Assister with Oak Hill Regional Community Development Corporation. And we're just excited. We thank you, Duke, for sharing all that information on our various programs.
Right. We're excited about the Healthy Together Mississippi because it brings everything together and let everybody know that we're covering it all. Whatever it is that you need or whatever your health concerns are, we got it for you. Just have to give us a call, contact us. Okay, so we're going to get started with our questions for tonight. The first question I have is who qualifies for Mississippi Medicaid or CHIP right now? Because I know it's a lot of confusion, a lot of things that are being said about the Medicaid and the CHIP program, that things are being cut and all of that, but still the eligibility depends on income, household size, and specific circumstances. You may qualify if you're pregnant, a parent or guardian of a child under 19, age 65 or older, living with disability or need nursing home care. You can also be a Mississippi, you must also be a Mississippi resident and meet income guidelines. So basically, being qualified for Medicaid really hasn't changed. I know there may be some changes coming up in 26 or 2027, but right now, that's the way it is.
Okay, we have another question, and that is, what if I lost coverage during the Medicaid unwinding? And of course, if you don't know what the Medicaid unwinding was, this took place during the period of COVID, after COVID, and Medicaid was extended, I believe, was it a couple of years, Ms. Penner?
Right.
And after the COVID pandemic was over, then Medicaid unwinding started, unwinding actually, and it was over. And so a lot of people that were not eligible for Medicaid, they were able to, they were able to keep it. But then after the unwinding, then they started closing those cases. But right now, you may still qualify. And if your income is changed, or you may even meet other criteria, you can reapply. So don't hesitate to do that. Be sure to check eligibility based on your current situation. And of course, it's based on income, household size, and I would go ahead and reapply.
Okay. Are copays still required for Medicaid recipients in Mississippi? No, as of May 1st, 2023, all copayments for prescription and healthcare services were removed under the Mississippi State Plan Amendment. Because at one time they were charging about $5 or $10 for a chip,
Right.
and then charging like a $5 fee for medication if your child was on CHIP, which is a child health insurance program. So if your child was on CHIP, they were charging copays for doctor visits and copays for prescriptions. But right now, they do not charge copays at all for any services um, pertaining to Medicaid.
Okay. We have another question. What services are covered under CHIP for children? And of course, CHIP covers doctor's visits, immunizations, dental and vision care, emergency services, and is designed to keep kids healthy and thriving. So these are the basic services, and of course, hospitalization should be on the list. I'm sure that's covered as well. But those are just some of the services that are rendered through the CHIP program.
As well as prescriptions, as well as that. The only thing CHIP does not cover is braces for children. Don't cover braces, but they cover everything else. So now we're going to take a little break, and we have Mr. Clarence Campbell that's on with us. Mr. Campbell?
Here he is.
Well, I don't think, oh, I guess my camera is kind of working almost. Good evening, everyone. Okay, I just want to say a few things about Affordable Care Act coverage, marketplace coverage, Obamacare, whichever you want to call it. Okay, as in years past, open enrollment will begin November 1st, which is about a month from now. So open enrollment begins November 1st, but unlike some of the last, I think about 2 or 3 years, open enrollment will end on December 15th. For a couple of years, we had open enrollment that would end on January 15th, and so you'd have an extra month to enroll, but that's not the case this year. I don't want to say too much about it because you probably are aware that there's budget battles within Congress right now, and these budget battles are about provisions that may affect what type of advanced premium tax credits may be available, whether or not there may be an increase in premiums, a sharp increase, a small increase, or things such as that. And that's still up in the air. Hopefully, that'll all be resolved by our next meeting at the next Ask Mary and Pat show. One thing that is still available right now, though, is special enrollment period. Special enrollment periods are available for, first of all, people whose income is 150% or less than 150% of the federal poverty level for their particular family size. You can enroll in coverage and have your coverage begin the following month, and that's still available for the end of this year. One of the things with the big beautiful bill is that will go away next year. So if you think that if you have some medical issues that you want to get taken care of, and you think you may qualify for the 150% federal poverty level special enrollment period, make sure that you contact one of the navigators so that we can possibly get you covered and maybe get these things taken care of that you need to get taken care of. And then there's also the regular special enrollment periods that are available. And these special enrollment periods are available for people that might experience some type of a life's change. A life's change could be a new job, could be or a loss of insurance, be addition to your family size, could be if you move to a different county, you have a different zip code. And let's see, new family member, loss of insurance, new job. If you even if you have the same job and you may not have been eligible for ACA coverage because your income wasn't enough at that particular time and you receive enough of a raise so that you think you might qualify for ACA coverage, that would allow you to apply under the special enrollment period. And these special enrollment periods are available from now until, let's say, the last business day in November. If you're able to qualify for an SEP between now and the last day in November, you'll be able to have coverage for this year. If you have any questions, whether or not you may qualify for any of these special enrollment periods, again, make sure that you contact the navigator. You can call 662-298-3584, and somebody will get you in touch with one of our navigators who can see if you qualify for a special enrollment period. And so that's about all that I have now. Hopefully at the next show, next month, I'll have better details in terms of what the provisions are going to be for the ACA in plan year 2026. Okay, any questions?
I had a question. I had to reach out to a consumer today that was needing health insurance. But of course, her children had lost Medicaid about a year ago.
Mhm.
And she felt that with her family income, she was going to be over the income limit. And she didn't have any of the life changes that you mentioned. Are there any other options?
Other options to qualify for a special enrollment period or other options for coverage? Case,
Yes, coverage.
I would just say that let's sit down with the consumer and complete an application with them and let the system determine whether or not they're eligible for the special enrollment period. We can use some of the guidelines, say you may not qualify, but ultimately the website healthcare.gov is going to determine who will qualify or who will not qualify for the special enrollment period.
Thank you.
Okay.
Need to unmute. I have a question as well. I thought that the ACA open enrollment ends on the 15th of December if you want to start your ACA January 1st, but you can go all the way to January 15th, but it won't begin until February 1st.
You may be correct. I may be mistaken there. And I don't have the information right in front of me right now, so I'm going to stick with saying come back on our next Ask Mary and Pat show, and we can give you the final rules for what's going on this year. A lot of things that we thought were
Yeah.
in place have changed and are changing.
That's so true because they're in the process of working it out or changing it or adding to it and
Mhm.
changing it. And so by the time November 1st comes, it might be something totally different.
Correct.
You know, so that's true. So you come back on our next show.
I'm
and
back
we'll
on the
have
next
the
show.
answer for you. But if you have any questions, you can always call the office and someone there will be able to help you with the ACA questions or with anything concerning to what we're talking about tonight. Thank you, Brother Campbell.
Oh, you're
Thank you
welcome.
so much. Okay. So our next question is, what if I no longer qualify for Medicaid, but still need insurance? And that's what Mr. Campbell was talking about as far as the Affordable Care Act marketplace. You may be eligible for a low-cost plan through the Affordable Care Act marketplace. Some plans cost as low as $10 or less per month, depending on income and tax credit. And I know they're working out kinks and things like that or making changes. So you may not be able to get a $10 plan or you may not be able to get a $0 plan, but they may be a little bit higher, but still you can always inquire and look into it. But a navigator from Get Covered Mississippi can help you enroll, which we are navigators, both of us as well. So we can help you enroll. Mr. Campbell can help you enroll as well. And we have other navigators over the entire state of Mississippi that can help you enroll. You can always call our office and they will send you to someone in your area if you're not in the northern part of Mississippi because we have them from north all the way to the coast. And someone will be able to help you, will be able to answer your questions. Okay.
Okay, we have another question. My child was dropped from Medicaid unexpectedly. What should I do? Well, first thing is to reapply because, I would go ahead and contact the Medicaid office immediately. And because the coverage may have ended due to paperwork or eligibility changes. And again, you can reapply or you can also appeal the decision. And some of the things are you have to make sure that the Medicaid office has your current address and contact information, because if they send you a renewal letter out and if you didn't respond to it, then that letter goes back to the office and they'll terminate it. So the main thing is to just go ahead and reapply, and we can help you as well. If you need to apply, or even if you need help with renewal, we can help you with that. And of course, that same number that Mr. Campbell gave you, you can give us a call and we can assist you.
Right. That number is 662-298-3584. We have another question. How can churches and community leaders help families stay covered? And that's a good question, because a lot of people attend churches and host enrollment drives. The churches could host enrollment drives. They can share updates during services and invite navigators to speak. Faith communities are trusted space. Use that influence to uplift and inform. And that's something that we can do. You can invite us to your church services, and we will talk about our services. Also, if you would like, we can host an event there at your church. We also have community baby showers that we have been hosting. And if you're interested, we can host a community baby shower at your church. So churches are very important to us, and the churches and the community leaders can really help get those individuals that need services with or that have health concerns. And that's an excellent idea.
Have your church leaders reach out to us.
Please do. Or your different ministries that you have at your church, to reach out to us, and we will come and speak to them about our services or things that are eligible for them, which they can apply for.
Okay. What role does spiritual wellness play in health coverage outreach? Okay. When families, well, actually, when families feel seen and supported spiritually, they're more likely to seek help. Integrating scriptures, prayer, and encouragement into outreach. And of course, this builds trust and resilience. So, of course, it plays a big part in it. And this day and time, we definitely need the spiritual help.
To be supported spiritually with your health needs and concerns. It's a central part, because that's where a lot of us meet, and that's where we get a real good understanding when it comes to spirituality. And we all have different beliefs,
Yes.
but it's still all one thing, and it's
Yes,
all
yes.
about getting your health needs met. Regardless of what it is, we always have somebody on staff that can refer you if we can't help, refer you to somebody that can may be able to help you with whatever needs that you have. And it looks like that's all the questions we have for tonight.
I don't see
Now,
any
does
in
someone
the
else
chat.
have questions in the chat or on Facebook?
No questions on social media.
Okay. But that's all we have for tonight. Like we said before, if you have any questions, you can always contact us at 662-298-3584, 662-298-3584. Our office is located in Hernando. You can come and stop by. We're located at 1775 Memphis Street in Hernando. You can give us a call. You can come by the office. We'll do appointments at the office if you need to. You can come and someone will be there to help you. If you're not in the Hernando area, we have someone, sisters that's all over the state of Mississippi. If you have a friend that lives other parts of Mississippi and you heard about us, you can give them a call and tell them that here, you can give them our number and give us a call, and we will find somebody in that area that could assist you. Regardless of where you live in the state of Mississippi, we got you covered. That's why it's called Get Covered Mississippi, because we got you covered. We just need you to, we're there for you. Give us a call, contact us. We're there.
Thank you so much for tuning in. And again, make sure to reach out to us about some of our other programs that, what we call them, Duke, that he mentioned at the beginning of the show.
Yes, ma'am. Just we're gonna let everybody know to remind everyone to visit our website, OakHillRegionalCDC.com. Better yet, I want you to go to healthytogetherms.org and check us out there. Also, don't forget to subscribe to that newsletter. I've dropped that in the chat for everybody to that's on social media rather, and I will put it in the chat for the ones who are on Zoom. If you haven't subscribed to the newsletter, again, just go check us out. We got you covered. Well, from dads to moms to Pause to Get Covered Mississippi to Healthy Kids Mississippi. We just all trying to be healthy together. And so I guess we will see you guys next month, which will be October the 27th for the next Ask Mary and Pat show, 6 p.m. Thanks again, everybody, for tuning in, and we're signing off on social media. And to the ones on Zoom, you're more than welcome to stay back and ask any more following questions or comments that you may have. Have a great rest of your evening, everyone.